Hi, welcome back to OET Online with West London English School. Today we're going to be looking at organising case notes. This is something that you definitely need for your writing. You need to be able to organise into paragraphs with the sentences and making sure that you're really getting the best out of the case notes. So let's begin. So last lesson we looked at how to select the relevant case notes and particularly how to make the most of the 5 minutes reading time. So to summarise that, the first thing you need to do is see who you are writing to and whether the reader knows the patient or not, because that will change the case notes that you need to select. The next thing that you're going to need to do is find out how urgent the case is and consider which case notes are extremely relevant. You can then look at the rest of the case notes and decide which notes are semi-relevant and completely irrelevant. Remember that in order to score highly in the exam, you will need to make the purpose of your letter clear at the beginning, and you must include all the relevant case notes. So today we're going to learn about 2 ways of organising the body of your letter. We're also going to look at how to order paragraphs and how to order sentences. So let's begin. Now, there's 2 different ways for you to organise the body of your letter. I mean, there's no perfect structure. There are other options, but we usually recommend 2 main ways that work for most letters. So the first is organising by order of importance, and this means just starting with the most important information, like the presenting issue, the purpose of writing, and the main symptoms, and then any relevant secondary issues like medical history, current medication, social issues, that kind of thing. The second structure is ordering chronologically. So that's the first visit, second visit, third visit, and today, for example. So we're going to start by looking at order of importance. Now, this is probably the most common way of organising your letter, to be honest, just because it clearly expresses the main problem to the reader right at the beginning. So this is the typical structure. It's the reason for writing and the main medical issues. Then we get details on the main medical issue and then any related issues. And finally, the discharge or the management plan. So let's have a look at some examples. Now, here we've highlighted the reason for writing and the main medical issue. So I'm writing to refer Mrs. Botley into your care, who requires physiotherapy for her dislocated shoulder. So we can see the reason for writing requires physiotherapy, and also the main medical issue, which is the dislocated shoulder. We then go into further detail regarding how the injury occurred and further details that a physiotherapist would need to know. Mrs. Botley dislocated her shoulder while kayaking. More specifically, she experienced anterior dislocation and tore her rotator cuff. The incident occurred 2 months ago when she was in a remote part of Africa. As such, she did not receive adequate medical attention and the muscles around the shoulder could not heal appropriately. We then have secondary issues, which in this case is the detail regarding Mrs. Botley's rotator cuff impingement syndrome. So here we go. Due to the poor healing of her clavicle, Mrs. Botley has developed rotator cuff impingement syndrome. It is therefore essential that Mrs. Botley is encouraged to do her strengthening exercises and stretches to regain lost motion. She has been prescribed ibuprofen, which can be taken up to 3 times daily. She should also be encouraged to continue taking her high blood pressure medication. And then finally we have a discharge plan, which is exactly what is required of the recipient of the letter. So here we can see it's physiotherapy 3 times a week, daily activities, so help with daily activities, and also a bed wedge pillow. Now the other option that I mentioned is chronologically. So if we have a look at these 2 options, we've got reason for writing and the main medical issue. Then we have our next paragraph, which would be maybe the first visit, then possibly the second visit, then the most recent visit, and then finally the discharge and management plan, which would always go at the end. Now, the other option for writing chronologically is this second one we can see, where in the second paragraph, we've got the first, second, and third visit. And the third paragraph is purely dedicated to the fourth most important visit. This could be the third most important visit. It just depends on the situation. Obviously, you're going to really need to read these case notes properly to make sure that you know which letter is going to be the right kind of structure for you. So here, again, maybe we've got the reason for writing and the main medical issue. I'm writing to refer Mr. Wilson to you, who requires assessment for his headaches. Maybe we would follow it with the first visit. Upon the first visit, Mr. Wilson was exhibiting signs of fatigue and headaches, which were preceded by bouts of depression. At this stage, he was also drinking heavily. We then go on to our second visit. When he presented again 3 weeks later, his lethargy had worsened and his headaches had become unbearable, leading him to take excessive amounts of painkillers. He also described unusual hallucinations during this time. Moving on to maybe our third and fourth visit, these might be the most recent. The last 2 times I saw him, he was beginning to recover quite rapidly. However, upon the final visit, the symptoms were still extant. As such, he was diagnosed with dengue fever and placed on antibiotics. And then we have our management plan. So I would appreciate it if you could kindly follow up on Mr. Wilson's blood tests and ensure he is taking his medication. He will also require a visit to the toxicologist in order for his fatigue and headaches to be investigated further. So that should be the paragraphs organised. But now we need to make sure that the sentences are in the correct order within a paragraph. Just have a look at this paragraph here. Just have a read of it now. What's wrong here? We can see it's badly organised. The sentences are mixed up. I mean, what is the relationship between headaches and your job and a chest infection? Nothing is the answer. They just shouldn't be put together because they're not related. So I'm going to give you some case notes and I want you to try and write a logical paragraph using them. Here we go. Just pause the video for about 5 minutes and have a go at writing a paragraph now. Make sure that it's logical and that you group things together. Okay, here's a good order. So we start with the neck pain history. We then move on to the description of the pain, the causes, when and where pain occurs, and finally medication. So we should have a paragraph like this, which as you can see is clear and logical. Just have a read of that now. Okay, let's do the same again. So we've got some more case notes here. Try and put them again into a logical paragraph. You can pause the video for about 5 minutes while you do it. Okay, so here we can see that smoking and alcohol intake, they've been grouped together. Then we've got diet grouped together, BMI, diet high in fat, recommended a low fat diet. And then we've got allergies, which again is related to diet. Just compare this paragraph with the one that you wrote. Okay, so that's everything for today. Just have a look, see what you can remember. Got a quiz for you. Just give yourself a few minutes to really focus on the answers and think about what we've learned today. If you want to pause the video now, you can. And here's your answers. I hope you've enjoyed this lesson and that it was helpful. Thanks for watching.